Mr. Berghaus is worried. From naming and shaming to safe care. Dear doctor, nurse, specialist, and anyone who works in a hospital. This is Mr. Berghaus. He's soon going to undergo open-heart surgery, but he's a bit worried about it.
Is this okay?
Last week he saw a television program about mistakes in Dutch hospitals.
Mistakes!
Much has been done in recent years to improve patient safety. But the work in Dutch hospitals isn't always carried out safely, with possible serious consequences for the patient. The media and politicians jump on it. And every time, with every catastrophic mistake, all parties, including the care professionals themselves, have the same reaction. Who is to blame?
Who is to blame?
Because the guilty must be punished, sacked, and preferably pilloried. And of course, new measures and additional rules must be created.
Okay.
And in any case, anyone who works in a hospital should be more alert.
Okay.
But penalties and calling on everyone to be more alert will not help. Because the person who gets the blame for a mistake is in fact almost always someone who was extra alert, but was in such a position that things couldn't help but go wrong.
But I was alert.
A colleague who should have passed on crucial information was called away to an emergency. The patient had been given the wrong medication just before surgery, resulting in a violent hemorrhage in the operating theatre. There was wrong information about the patient's status. Anyone who digs just a little bit deeper into what goes wrong in hospitals will agree. Errors are rarely the fault of an individual care professional. It's almost always a combination of factors. Miscommunication, failing technology, being distracted, and a culture where people don't speak to each other. So it's the system in which healthcare professionals work together. But the fact that the errors are a result of the system doesn't mean there's nothing the individual healthcare professional can do. If errors are triggered by miscommunication or failing technology, then that's precisely where someone can do something. Let's take a look. Nowadays, in all hospitals, errors and near errors are recorded in a management safety system. This register is sometimes regarded as a tedious chore, until someone actually does something with those reports. Because then it suddenly becomes clear where the mistakes actually originated and how huge improvements can be achieved, sometimes through a few simple measures.
Huge improvement.
Analyzing mistakes means something else happens. You look differently at your surroundings. It suddenly strikes you that a colleague is dispensing drugs at the busiest time of the day. It's visiting time, there are food trolleys moving around, and half of the team is on a break. And look, she even has the department phone in her pocket too. If you have ideas about how it could be improved, then discuss them in the team meeting.
Okay.
Another interesting technique, a simulation drill. A doctor's assistant is called to the delivery room where a simulation patient has a hemorrhage that can't be stopped.
I'm coming.
Solve it. A student midwife reads the protocol point for point. The doctor's assistant instructs the treatment team. Afterwards, everyone is debriefed. And then you learn not to ask, who's going to order some blood? You have to appoint someone. And you don't just assume that after ordering blood the nurse is coming back. You have to agree that.
Wait, return immediately.
You learn that before any operation, take a brief time out with the whole team and ask, are we doing this correctly? What are we overlooking? Experience shows you got so much more control over the process and that you additionally operate more as a team. Everyone using their own expertise, but all equally valuable. Asking someone when something seems to go wrong is suddenly no longer scary, but perfectly natural.
Oh, yes.
Most people also find the work much more agreeable than the traditional way, with the highest ranking handing out all the orders and the rest having to follow. Devising something yourself that enhances the focus on safety is also possible. For example, Mr. Berghaus's surgeon always briefly tells the operating team something personal about the patient. This is Mr. Berghaus, he's 53 years old, and hopes next month to become a grandfather for the first time. You can bet everyone is just that little bit more alert. In the coming years, all healthcare professionals in Dutch hospitals will be working on increasing patient safety. And so, we are appealing to you.
Me?
There is no predetermined method. Everyone chooses the approach that best suits the situation on the ground. It will mainly revolve around skills, such as cooperation, making the area safer, better communication, learning from mistakes and apologizing when necessary, creating a culture in which you can be critical, and becoming more aware of where the risks actually lie. And we all have the same goal. A patient care system where not a single patient ever again is the victim of medical malpractice, and where no care provider has to suffer ever again from a failing system. And where Mr. Berghaus will indeed become a grandfather in a month.
Ho, ho! Ho, ho! What can I do?
For more information, go to ikwerkveiligindezorg.nl. This video was commissioned by Care and Nursing the Netherlands, the Dutch Organization of Hospitals, the Dutch Federation of University Medical Centers, and the Order of Medical Specialists.